Hello, Mrs. Carroll. How are you doing today?
I'm good.
Good. How's the recovery going?
It's good.
It's good. So you had your stroke about 6 weeks ago, and right now you have been placed on a modified diet. But our goal over the next few weeks of rehab is to strengthen your muscles used for swallowing. So today I wanted to talk to you about a therapy technique called electrical stimulation. Have you ever heard of that?
I don't think so.
Okay, well, this is a picture of what it looks like. You can see these electrodes are being placed on this man's neck and throat, and sometimes you can place it on your face, and then the speech therapist is controlling these electrodes with this device, and he's able to eat and drink. And what is going on in this picture is his muscles are receiving stimulation, electrocurrent waves that are helping excite the muscles and make them move better for him to swallow. So basically, since you've had your stroke, your lower motor neurons, the neurons that are responsible for sending the message that your muscles need to move for swallowing, are not working so well. But you still have great sensory, which makes you a candidate, and you still have great motor skills. So what this device is going to do is it's going to send the electrocurrents to your muscles, your pharyngeal and laryngeal muscles, and it will excite them. And so when you try and swallow will hopefully become easier for you because these muscles are being excited. Does that make sense?
Yeah, that's fancy.
I know. So what we're going to do is we're going to hook these electrodes onto your neck and maybe some around your cheek, and you're just going to eat your normal meal, and it's going to last for about an hour. And we might do some swallowing techniques like an effortful swallow or a double swallow. And so you're strengthening your muscles with the help of this device. And together, hopefully, we can improve your overall swallow function. What questions do you have?
Does it hurt?
It does not hurt. You'll definitely be able to feel it, but we won't leave it on for a long amount of time. We might do an hour max, maybe a little bit less in the beginning, and you'll just kind of feel some tingling. And I can control how powerful the electrocurrents are, so if it's ever uncomfortable, we can bring it down a little bit. So with your swallow paired with this device, hopefully there will be some strengthening of the muscles. So like I said earlier, you're a good candidate for electrical stimulation because your motor sensory skills are still intact. So that's good. And I wanted to tell you about 2 research articles that I found. One was The Effects of Surface Neuromuscular Electrical Stimulation on Post-Stroke, which would be you, a systematic review and meta-analysis of clinical rehabilitation, and that showed that patients who were hooked up to electrical stimulation or Vital Stim, which is a brand of electrical stimulation, did show improvements during their recovery time. And is non-invasive neuromuscular electrical stimulation effective in severe chronic neurogenic dysphagia? Report on post-traumatic injury patient. And that they found that it is beneficial for patients to have electrical stimulation. So if you don't have any more questions, we can start therapy and hook this device up to you, and hopefully we'll get you back to a regular diet.
This technology is amazing.
I know. Okay, so I explained to Sarah how electrical stimulation would work kind of in layman's terms, how you explain it to a patient, but I want to make sure that from a neuro standpoint, you understand how electrical stimulation works. So I thought I would read what ASHA had to say on their website about electrical stimulation so that you understand when you're thinking about the brain and upper and lower motor neurons, you understand what's happening. So electrical stimulation is the application of current to living body to stimulate nerves or nerve endings that are either sensory or that innervate muscles. Electrical stimulation is applied to stimulate neural tissues, nerve endings that innervate muscle fibers or sensory nerve endings. Normally, a single axon from a motor neuron in the brainstem or spinal cord innervates several fibers within a muscle via neuromuscular junctions. An action potential traveling in on an axon releases acetylcholine, a neurotransmitter, at a neuromuscular junction. The neurotransmitter then binds to acetylcholine and receptors that activate and generate a muscle fiber contraction. But what we know, if there has been a stroke or a traumatic brain injury or dysphagia has occurred somewhere that impairs and and the lower motor neurons are impaired, which can cause dysphagia, then that's when the electrical stimulation comes in. And the electrical current can be applied to a muscle by implanting the electrode directly into the muscle tissue. This technique is largely experimental at that time, and it's a less invasive method to apply current transcutaneously using electrodes to the skin, which is called transcutaneous electrical stimulation. So, candidates for electrical stimulation include patients who have had injury to their central nervous system, so that could include a traumatic brain injury, removal of a brain tumor, or stroke. And a key piece of electrical stimulation is to remember that patients can only be considered for electrical stimulation if they have healthy sensory and motor nerves.